today we go to the women in your life and have this conversation. The word is endometriosis. You'll be hearing it a lot this evening. Definitely have amazing guests in studio. Karibuni sana.
Thank you very much.
Good evening.
Good evening.
Let's do introductions. We want to know, who do we have in studio?
My name is Elsie Odhiambo, and I'm the founder of the Endometriosis Foundation of Kenya.
Great.
Dr. Charles Muteshi, endometriosis and fertility specialist.
Okay.
Also a gynecologist.
Endometriosis and fertility specialist. So we welcome all your questions on these two topics. Can we start by defining this before we go to another conversation? What is endometriosis? Who is it?
So essentially, when we talk about endometriosis, it's easier to describe it than to say exactly what it is.
Okay.
But if you look at the female reproductive system, we've got an organ called the uterus, and this is the womb, or where the baby would normally sit during gestation. But the lining of the womb is called the endometrium.
Yes,
and that is what sheds every month. Now, the cells of the lining of the womb may be found in other places outside the womb lining, and that's what we call endometriosis.
Wow. Elsie, you have a personal experience.
I do.
What
I've
is
had it
that?
For so, like Charles said, like it's difficult to like describe it. Even the pain, like it's very difficult. And I think one of the things that I grew up knowing for a very long time, until I was around 26 when I was officially diagnosed, is that pain is normal. Period pain is normal. So even like we've grown up in a society that has just normalized pain. You know, like for women, it's okay for us to go through period pain. Like, hey, you know what, stick it out. Like, just
Be a woman.
Be a woman. Like, just tough it out. And so I grew up, and from around, I think from the moment I started my period, I was just in a lot of pain. And for me, it meant getting injections, going to the ER, etc., and just terrible experiences until I was now definitively diagnosed. And probably, Dr. Ray can weigh in on what, how you definitively diagnose endometriosis. And so that happened when I was 26. And so in general, for a lot of women, it takes an average of about 8 to 9 years before they are officially diagnosed. Because I think, like we said earlier when we were having the conversation, it's a complex disease, and the symptoms mimic other conditions. So in, like, when I'm growing up, what people are saying around me is, she's feigning illness. The comments come like, Kwani, what kind of periods are you going through? Like, and from a woman to a woman, it's like, because you don't know that pain. For me, because mine is invisible, it seems like I'm faking it, and I'm trying to get away, from
Get off duty to work, especially in high school.
Yes, and school was tough because, you have you're sick, but you feel like no one is validating that pain, and no one is just acknowledging it. So it was terrible. But I really had supportive mom, supportive dad. So really just having that support structure around me, I think for me was critical, even for my family. So until I was definitively diagnosed, like, they really held my hand, and even right now,
that's amazing.
They still continue to just
the conversation on today's show is on endometriosis, but we must just take a stop because we're in a coronavirus season. We weren't able to hug. I mean, I haven't seen Elsie in 2-3 years. We weren't able to hug because of the situation. Can you just weigh in on that before we share a quick video right now? How has endometriosis affected you, especially the practice?
I think what I've come to learn is that a lot of people have become aware about endometriosis, and the whole conversation around reproductive health is changing, mainly from taboo to a subject that can be discussed openly. As you heard Elsie say, there are various reasons why there's been delay in making a diagnosis of endometriosis, and part of it is normalizing period pain. When you speak to the girls who eventually have endometriosis, they will have seen a doctor or a healthcare worker initially, but because they came in with period pain, they are told your pain is normal, so it takes that long.
So they got a Ponstan, a Brufen, this one's...
Yeah, all manner of things. My question actually is, before I go to a video, I'm going to a coronavirus video. We interrupt this programming because we must have this conversation as well. For you guys, how has coronavirus affected you so far before we get back to the conversation on endometriosis? Clearly disruptive, obviously, and you have to be very careful with everything. I think up until the weekend, we thought 1 meter distant is safe enough, but now the WHO has advised that it is airborne and it can stay around for a little longer than we thought. It's a bit scary. It is. And it does have symptoms that will vary depending on a person's or individual's ability for their body to resist disease. So those who are older or frail or with other medical conditions are more likely to be affected more. And the responsibility that we have to call upon everyone is to protect them, because you may make the assumption, I'm young, I don't think I'll catch corona, but it's really that public health responsibility to safeguard others. It is, absolutely. Before I get Elsie's comments, let's check out this fact of coronavirus with Dr. Christine Chege.
It is a group of viruses that have been known to cause respiratory disease. So we have 7 known types of coronaviruses. The first 4 are just viruses that have been there with us for long and cause common colds. The last 3 classes of viruses have been, in the last 2 decades or so, been known to cause severe respiratory disease. So the virus that people are calling coronavirus is actually one of the last 3 viruses known to cause severe respiratory disease, and it is the virus called severe acute respiratory virus type 2, coronavirus type 2, SARS-CoV. And this virus causes what we are calling coronavirus disease of 2019, COVID-19. So that is the coronavirus that is causing the current pandemic. What is worrying about this virus is that some people can be infected and actually transmit the virus, but they do not have any disease symptoms at all. Others may have just mild respiratory symptoms where they only have a cold, like a flu, a runny nose, a cough, and a little bit of fever. Now, the category that we are worried about are those who, the 15% or so, who may get severe respiratory symptoms, and that would be in the lower respiratory tract, so that would be pneumonia. It is advisable that if you feel that you have those symptoms, which are fever, a cough, and maybe a cold, and you have come into contact with somebody from a high risk country, you can call your doctor and ask what to do next. Or if you come to hospital, don't just get into the hospital. There are screening areas right outside. Present yourself to those people who are screening and let them know, and they will advise you on what to do next. This virus does not just reside in the air. It needs to be transmitted. So how is it transmitted? If I cough or sneeze and I don't protect my cough or sneeze like this, with the inner surface of an elbow or a disposable tissue, then those droplets that I spray have the capacity to travel up to 6 feet or up to 2 meters. And what do? They either land on another person, infect them through their mucous membranes. And what are these mucous membranes? These are the linings of the eyes, the nose, and the mouth. And those are the portals of entry for this virus. How else? If my spray from my cough or sneeze lands on a surface, for example, it lands on a table, a chair, a tap, a wall, a door handle, a window surface, and somebody else comes and touches that surface and touches there, those parts that I mentioned, the mouth, the nose, the eyes, those are the portals of entry. And take note that this virus can remain viable on surfaces up to even 9 days. That is how long the coronaviruses can remain on surfaces. It would be good to use a diluted bleach and just disinfect the frequently used surfaces that I have mentioned. But otherwise, you can just use the available cleaning detergents that you have and make sure that frequently you clean those surfaces that I have mentioned. This disease has caught all of us unawares. Nobody knew it was coming. We have to come up with guidelines along the way. This is not the time, because you've been told to work from home, this is not the time to go and visit your family, your friends, to catch up and have coffee. This is the time to stay home. Limit the way your children are interacting with other children. So if you have to be somewhere, make sure you are spaced at least close to 2 meters apart from the next person. Every one of us is at risk. Why am I saying every one of us is at risk? Because this is a new virus where no human prior to 2020 has been exposed to this virus. So nobody has had immunity to this virus. So we have to spread hope to people. Let us not panic. Let us stop forwarding unverified information that is just serving to scare people. Let us listen to the updates from the Ministry of Health, from WHO, from CDC, and your trusted healthcare provider. They have the right information.
Here's the importance of getting the right information. And we're coming back to Elsie's comment on the same. I hope that video has also chanua kidogo.
I really feel like I'm watching a bad movie. Do you feel that way? Like, am I
I
alone?
do.
Like, I'm just like, what is going on? Like, I think I'm at that place where, okay, fine, I'm accepting what is happening. But for me, I think I'm okay because I'm an introvert. So staying at home is like really, really
Best life.
It's like I'm in heaven right now. But of course, just imagining the people who might potentially be exposed, for me, and don't even have access to any medical care whatsoever. That for me is what is really stressing me, and I'm really praying for the Lord's hand just to bear upon this situation.
Amen.
And I know that, and I'm just praying that even after this, after we just go through this and we come out on the other side, that government just thinks about doing the right things and just investing in the health facilities and making sure that we're better prepared for our next time.
Absolutely, they are watching this day, and we hope that we will take all this to very serious consideration. This month, however, is Endometriosis Month. Is it called Endo Month? That's why we are focusing on this particular disease. Let's talk about that. Why this season? And you have a beautiful yellow flower. Is that the color?
It's the color of endometriosis. So sometimes I feel like I overpower people when I dress up in yellow. So I just usually make sure there are just some small cues, So either it's my
You're
whatever.
a real introvert.
I am. I'm just like, it's for me. It's not for you. It's for me. But hey. So yeah, and I think it's just, I don't know how they decided that it would be March. But for us as the Endometriosis Foundation of Kenya, we've been celebrating it. I think this would have been the 6th year that we would have done it consecutively, where we just joined the global efforts in raising awareness about the condition, because this condition, no one knows it. Even the women who suffer with period pain still minimize like the pain and still don't know even the name that this condition and this pain has a name. So in the month of March, we just focus our efforts on just making sure that the public we improve the public's knowledge and understanding of the condition. We point them to the right doctors, to experts with the knowledge and understanding, not just basic knowledge, but you know that these are people who are even certified in a way to treat the patients, because you know you get a lot of quacks out there, like even right now. I mean, even just you know how people are coming up like with new sanitizers and stuff like that. With endometriosis, you have to make sure that you're seeing an expert.
Yes. This is a disease that affects over 176 million women around the world, and that's just a tip of the iceberg. We were talking about the symptoms and the diagnosis. Can we go to that?
Yes. So mostly pain would be the predominant symptom with endometriosis, and it's related to periods, but not exclusively. So initially it may start with pain around the time of periods, sometimes pain with mid-cycle or ovulation, and in some girls you will have pain that is present throughout the cycle. There may also be pain symptoms that come with the physiological activities, meaning if you use the toilet, it might be painful. And there could be symptoms either related to pain or otherwise in other organs that are affected, which are not necessarily in the pelvis. So getting very cyclic chest pains or coughing up blood, or very rarely you could have seizures or you know, convulsions around the time of your period. Those quite rare though. The other symptom is usually related to inability to conceive easily, and this is only discovered when you've been trying. So there's no way to tell that someone with endo may be unable to conceive when they need to. But there are also other associated symptoms that come which are not quite specific, and this is by the fact that it's probably chronic, and someone going through endometriosis has their quality of life affected greatly. So it's not uncommon to find maybe mental health issues, for example, anxiety, depression coming with it. And we also find symptoms that are related to the bowel, bloating, discomfort, which may be made worse by dietary habits, for example. In terms of diagnosis, it requires, first of all, a high acuity, that somebody will think a patient has got endometriosis. And depending on the demographics of the patients you might be treating, a busy general practice, seeing young girls may think, oh, they're coming with pain, they have pelvic inflammatory disease. It's true they might, but you need to do a test to confirm. You can't just
What is this test?
So we start off by doing an assessment, which is an examination in medical terms. So we may, you know, place a hand on your belly and feel for, sometimes you could feel a mass, or it could be tender or painful. And depending on the age and the circumstances, you know, we can see disease around the cervix, for instance, when we do a test like a pap smear. And an ultrasound scan, which is a way in which you can look inside to see. But more definitively, if you want to have proper diagnosis, then you would require what you call a laparoscopy, and even going ahead to take some tissue to
from
the laboratory.
Wall?
Yes.
Okay.
Not from the wall, but from the inside of the pelvis.
From the inside of the pelvis.
Yeah.
So we're talking about a disease where the endometrium wall, if you did biology, this is the only thing I think I totally understand about this, is you go to the entire process, the endometrium wall then thickens and sheds. So that thickening can go to your lungs, can go to what other part of the body?
So basically, we find that these cells are similar to what you have in the womb lining.
So they're similar.
They may not necessarily migrate, but
Okay.
yeah, they're quite similar.
Right.
Wow. Let's talk about you finding out you have endometriosis at 26 years old. And all this time you have been that dramatic girl.
Right.
What is that about?
So it meant for me, so even just before discovering, and what led me to just be curious about it was, you know, I'm missing work several months, several days a month, and, you know, just always going to the ER and just popping constantly pain meds, you know, over-the-counter medication. And I just realized, okay, I'm not helping myself, one. Two, I really need to find out what is going on. So I then went and visited a gynecologist and asked questions like, what's going on with me? And I remember the simplest way that he could tell me what I was suffering from is to say that my uterus was growing inside out. So that was so cool, because I was going to my friends like, oh my God, my uterus is growing inside out. Do you have a womb that is growing, you know, your uterus growing inside out? So for me, that was the easiest way he could tell me. Like, I mean, and you can imagine this was like this was a long time ago. Let me not disclose.
I was just going to start doing the math.
I was just over here like just, you know, doing that. So I was like, no, let me not. So yeah, it was such a long time ago. So, and then, you know, I had to go through my first laparoscopic surgery, and that's when I first got to find out, okay, it is endometriosis. So he at first, like, you know, Charles said, did a scan, did just that basic.
So he was the gynecologist you went to? Did you say Charles?
No, so like I was saying, like what Charles said.
Okay.
Like how you test, do those, you know, those basic tests. That's what the doctor did then. And then he said now he wants to go in and just investigate, and that's when he did the minimal invasive surgery, which is a laparoscopy, and then discovered that it was endometriosis. So by then it had, I had developed an ovarian cyst, which is one of the other symptoms of you know, that you could be having the condition. Then when they tested, yes, they said it was endometriosis.
Wow. I want to welcome you to send in all your questions, your comments. I'm sure this could be confusing for those who are hearing this word for the very first time. The conversation is on endometriosis. The text line is 22232. Our call line will be open shortly. It's on the screen, so just check that out. But text us right now. I'm receiving all your messages, and we'll be going ahead to ask the questions to the doctor. That's 22232. Even as we do that, this laparoscopy.
So it's a form of surgery,
yes,
but we call it keyhole in colloquial terms. So basically, it's passing a telescope through the belly button. That's the commonest place.
Okay.
Yeah, so that enables us to look inside and see, and there will be accessory ports or other sites where we pass long instruments which we can use to operate or take tissues away. And the advantage of doing this is that you may go home the same day, so we have something we call day surgery. It's not the traditional operation where we've got a big cut on your tummy and you have to stay a few days in hospital. Pain meds requirements after that type of operation are less. You're more likely to go back to your routine normal activities sooner. And obviously it has less complications.
How long does the diagnosis take?
So once you've made the suspicion and you can take appropriate steps to make a diagnosis, then that will be quick. And in fact, you don't need confirmation by tissue diagnosis to say someone has got endometriosis, because by looking with the laparoscope, you'll be certain that they do have endometriosis. Now, obviously, what is still a mystery is that, especially with pain, the amount of disease that we would find in the pelvis does not always correlate with the symptoms of pain. So you might have very minimal endometriosis and excruciating pain, you know, quite severe. And sometimes we have found endometriosis incidentally when we are doing other procedures and there are no symptoms.
Wow. there's some terms we need to define, because we're here,
Right.
you know, saying what are some of the things and the wordings. I'm hearing, I see Endo Warrior on Facebook.
Right.
When I look at your page,
Yeah.
I see Endo Month, Endo.
Well, there are many hashtags, you know,
Yeah.
people can come up with.
Yes.
But endo warrior is the term that you use to define, or rather not define, but just to
Call.
say, yes, to call. I'm just very careful.
Yes, please.
So yeah, so to refer to
Refer
a
to.
person
Good.
who is actually suffering from endometriosis, who has actually definitively been diagnosed. Because I mean, everyone then can become an endo warrior. Do you know what I mean?
That's true.
So these are for people. This is how you refer to, just the same way I think we're talking about it, like cancer soldier.
Yes.
So an endo warrior
Okay.
is what it is.
Okay. Something that's come up. Is this a very hush-hush conversations? Do people come and they want to close the door and say, I'm feeling, you know, I'm feeling, like, why is it this conversation out there?
I think it's the fact that you get frustrated over time because nobody seems to listen to you, and the only person, perhaps, if you come and meet your fellow sisters who are talking about the same language, and then you get the courage to say, I don't think anybody else should go through this, and you know, the conversation has now come out, and I think credit to organizations like the EFK, we now have people talking about it. And in fact, the focus is more on the young girls who need to be made aware that it's not normal to just have period pain. So it is better to have a diagnosis made earlier, and you know, to avoid suffering, because this is a very critical age in development, and a lot of life decisions and you know, eventually how you end up is determined. So if you're distracted from it because you are suffering from something that no one acknowledges, then that is going to be devastating.
That's true.
I have a question. There's this levels of pain situation that happens. Like, I'll be asked, from a scale of 1 to 10, how much pain are you feeling?
I don't
How
think
do
we're
you
in
know?
the 10. I don't think we're even in between the 1 and 10.
No.
Ours just goes off the chart, because how that pain manifests in different people. Some faint. I think if I'm talking, I mean, like, and very many women will actually be able to acknowledge the fact that there were some girls who used to pass out in high school
I will actually.
because of pain.
Yes.
You know, for me, for example, for me, it's impossible to walk. So I'm usually like in a fetal position most of the time if I'm in pain, and it's just like you feel like there's 6,000. It's like, I feel like it's actually, in fact, I've just thought about it. It's like a grenade exploding in your uterus, and then the shrapnel just, you know, in there, and it's just feeling very tender. The only way I can describe it is you're the most tender, like, even just from head to toe, you just feel like everything is tender. You can't touch, like, if anyone touches anywhere, it's like pain. But
Yeah.
again, like I said, for different women, it manifests in different ways, and that's why endometriosis is not like diabetes. I usually say that. I usually try to give that as an example, and Charles can correct me. It's not like you can take blood from here and you know that this person has diabetes,
Sugar
and this
levels,
is, yeah,
this is how they look
and
like,
this
yeah.
is what it looks like, and this is how you address it. For different women, it needs to be addressed differently.
Wow.
So what he will prescribe for me might not be the same that he would describe for you, because of how it manifests itself, because of how you know, the symptoms and what it will take to manage. So yeah.
We're about to go on break with the first aid segment, but one of the texts that I can see here is someone saying, I have been bleeding heavily. Is that one of the symptoms?
Not entirely, but obviously if bleeding, which I would assume is menstrual bleeding, it's not specified, would be advisable to seek medical attention. Just from the simple fact that blood is supposed to stay in the vessels, and if you lose lots of it, you can exsanguinate, which means you could possibly become very unwell.
Exsanguinate.
Yes.
Okay. Well, Jesus healed the lady with the issue of blood can definitely heal endometriosis. I have that confidence and the trust. We'll be right back. This is a first aid segment. You're watching Health Check. It's on Hope TV. It's where you look and live. Welcoming all your questions, comments on endometriosis to 22232, and we'll be picking your calls when we come back.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days and seek immediate medical attention or report to the nearest health center. This message has been brought to you by the government of Kenya and its partners. For accurate information on COVID-19, dial *719# or call 719. Follow us on Twitter at MOH_Kenya, at spokesperson GOK, at WHO.
So in this segment, we are dealing with a patient who's unconscious and therefore not breathing. So first, you look at signs of breathing. Number one, how do you know if a patient is breathing? You check the movement of the diaphragm, the chest, whether it's going up and down. And then you can also check the pulse of the casualty to know whether they are breathing or not. So the patient is not breathing. So what do you do so that you save the life? So once you realize your casualty is not breathing, you call an ambulance, you call for help, and then you begin doing CPR. Because if the body does not get oxygen for some time, the organs will be damaged. You give 30 chest compressions and 2 rescue breaths. So this is how you do the CPR. You ensure that your elbow are straight. You fold your hands like this, and then you place it on the chest of your casualty. Ensure that your elbows are straight, and then you do 30 compressions. You ensure that your elbows are straight. So you do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then you come and do 2 rescue breaths. So this is how you do it. You tilt the head and lift the shin. To prevent cross-infection, you use the resuscitation mask. You put it here and give 2 rescue breaths. So, yeah, and then you give again 30 compressions, chest compressions, and then you give again 2 rescue breaths until the casualty recovers.
For keeping it right here on Health Check. My name is Kerry Kagiri. We are back. Today's conversation is on endometriosis. And Daktari had mentioned, let me introduce our guest. So in case you just joined us, please meet our doctor,
Charles Muteshi.
Charles Muteshi, and the founder of the Endometriosis Foundation of Kenya.
Correct. Elsie Odhiambo.
Oh, you have to put all of them.
You have to.
Very good. The doctor did mention that fertility could be one of the issues when diagnosed with endometriosis. And for you, have you struggled with that as a married woman?
So, again, so when I was first diagnosed when I was 23, around there, 23, 26. No, 26. the doctor, one of the things the doctor was telling me was, you need to get pregnant. So I kept looking at him like, what do you mean get pregnant? Because he's like, it'll get harder. But I think I dismissed it because I was like, you know, who are you? You're not God. You know, you're not going to tell me when I'm going to get pregnant or not. So I remember that conversation now, because I think when I was, so I've had 3 surgeries in total.
Wow.
To just help me manage endometriosis. And I think it was after the 3rd surgery that we had to, actually just before the 3rd surgery, that we had to check what were my egg levels, and I think Charles can talk about that. So we discovered that because I was getting the surgery was around the ovaries, because they were removing the ovarian cysts. It's like, it's inevitable. It's something that it's not their fault. I don't blame them. So they would have, it's like it just touches the egg reserve and it just reduces. You see, for us women, we that's our only
egg reserve.
Exactly.
Wow.
It's not like guys. Guys produce sperm for the rest of their lives. As ours, it's based on what is in there, and then over time, as we age.
That's the case.
And yeah, so
yes, unfortunately, we we live in a finite world of resources, and eggs is one of those.
Oh, imagine.
And they do decline and dwindle over the years until the menopause. Now, the problem with conditions like endometriosis, which may affect your ovary and need surgery, particularly repeated surgeries, normal tissue is taken away inadvertently when you remove endometriosis. You have to be extremely careful, and that conversation needs to come before the operation.
That's true. That this is the risk.
Yeah,
wow.
So I think that's what I think for me I discovered, and I was so gracious to have a doctor who was willing to have that conversation with me before and said, girl, I know you're about to get married, and I know that this is a very delicate conversation, and you need your future husband to know in case there is a challenge when you guys are trying to conceive when you get married. And indeed it's the issue. So for me, I'm perimenopausal, and so I have a very low ovarian count, which is something called, I think, subfertility. I think Charles can give like the technicalities.
Yes.
But endometriosis hasn't affected me. But do I believe that I will never get a child?
No.
Because you see, the ability to conceive is a very divine thing.
That is true.
And I don't dismiss the fact that God can do anything, even
so
in
we
this
keep
time.
trying.
We keep trying.
That's amazing. Wow. Perimenopausal, and what happens in these surgeries that she has had to go through?
So the ovary is an organ that is quite amazing and actually remains a mystery. But apart from producing eggs for fertility, there are hormones that it does produce to maintain, femininity and just wellness generally. One of those hormones, very critical, is called estrogen.
Estrogen, yes.
Yeah, so estrogen, it will keep your blood vessels stable, for example. It maintains the lining of the reproductive system. And it also has a very, very critical role in maintaining bone health. So if the ovarian function is declining, so apart from the eggs just going down, we also know that the hormone production will decrease significantly. And unfortunately, some women, it may actually cease. If this happens before the menopause, then the effects on other organs will be significant. So you are much higher risk of, having brittle bones. And menopause symptoms, the commonest will be what we call hot flashes, just because the instability in the blood vessels and the way the temperature regulation is done. But there may also be other effects like burning sensation in the genital tract and what we call vaginal atrophy.
This is the time when we are about to answer all your questions. You can text us on 22232. You can call in. Our call lines are now open. We try to keep them open at a certain time, and we'll be picking the questions as we go. Call us on 0708-756396. We're looking forward to hearing from you. The rest of our call lines are on your screen. Keep calling. Premenopausal. I'm very curious about that.
Perimenopausal.
Prairie.
Oh.
So peri,
sorry.
yeah, peri means just around menopause, and it's terminology which is rather technical.
Yes.
But the word menopause itself means the cessation of menstrual bleeding. We wouldn't make that diagnosis until it's been 12 months or longer since you had your last menstrual bleed.
There is an age though.
Yes, so there's an average population age, and generally it's accepted that around the age of 50 women may go into the menopause. If that happens after the age of 40, but before the age of 45, then we call it early menopause.
Wow.
However, this could also happen before the age of 40 for various reasons, and if that is the case, then we have a terminology that we now call premature ovarian insufficiency, previously called premature ovarian failure. So the reason for these varying terminologies is mainly because of the implications on health. Obviously, in younger girls, fertility is paramount, but as I said earlier, estrogen has other functions, and you know, if you don't have enough circulating estrogen levels, and it's a critical time to build bone health, you know, wellness, hot flashes come in, and your quality of life might be miserable.
Many people are looking at me like, Kerry, you are demon-chasing, spirit-filled. Sarah, explain Sarah giving birth at 90. But we'll get to that. Is endometriosis preventable?
We don't know, but partly because how it comes about is still mystery. And I think having an early awareness of what is causing symptoms may help one navigate through, you know, the rough waters that come with managing endometriosis. We do know, for example, that taking the pill for a longer time may, you know, lessen pains, but we haven't got any conclusive evidence that doing that will prevent endometriosis developing.
Okay, we have a phone call from Emmanuel in Kasarani. Good evening, Emmanuel. Good evening, Emmanuel.
How are you?
How are you, sir?
I'm okay.
What question or comment do you have on the topic of endometriosis?
In fact, I was just concerned about the other day. I was sick about syphilis. Then I got healed. Then after some time, I used to hear some pain just below my sorry?
Yes, we can hear you.
Below
Continue.
my waist. So I just wanted to some advice.
Okay, so you've talked about an STD.
Yes.
Okay, that's good. Okay, we'll be getting to that question. Thank you, Emmanuel, and for watching. We appreciate you.
Welcome.
Good. That call line is open. And that's a gentleman. I think he had the organs and he was like, might I be in this mix?
Right.
But you can, as we define it one more time, you can speak to that. I'm sure you have a response to that question.
Yes, certainly. So I wouldn't want to split hairs, and you know, we live in different times. Wouldn't want to ask whether Emmanuel is a boy or a girl, but endometriosis is actually predominantly a disease of females. So if anyone has got pain that they think is unusual, should be able to visit a doctor.
Yeah, so it's important for you to go see a doctor right now just to make sure that everything is well. Yes? Okay. But also, can you just define endometriosis one more time? Just so that, and I know there's no definitive term, it's more of an explanation. There's no, it's the process by which, you know.
Yes, so I think importantly for the public to know is you may not self-diagnose with endometriosis. You may have symptoms that could suggest you have endometriosis. And in fact, the definite diagnosis comes from the lab, which means you have to take tissue by an invasive procedure. But basically what endometriosis means is you've got cells that look very similar to those of the lining of the womb. The womb is the uterus, or where the baby normally would gestate. And those cells are outside the lining of the womb. So that phenomenon is called endometriosis.
Wow. How are you living with this? Because I've had the word manage so many times.
Yeah.
Of course, I had the question, is it curable? But let's go to, how are you first living, Miss Endo Warrior, Mrs.?
Oh man, it's I won't lie, like it's and I won't try and make it look as flowery as my dress and as the flower I'm wearing. But this is just so that you kind of just put up a front and just say, guys, I'm okay. But it's tough. It's really, really, really tough. I just very recently started going through just bouts of fatigue and just exhaustion and just getting tired and not feeling like waking up in the morning, because it's very it's discouraging. Also just knowing that I'm not able to conceive, I'm a new wife, I'm trying to be a happy, fulfill the and check the boxes of like a perfect wife is like you get married, then you have babies, then you make your family happy and you make your people proud. But of course those are internal pressures. There's no one who has put that list out there, but there's that, and then there's just the perpetual pain. It just feels like it's not going away. That then led to just another doctor after talking to Charles, and he's like, I think you need to see someone else, and that has affected my mental health. And then gotten the fact that, hey Elsie, you're actually struggling with depression. So this is where it's like it's a slippery slope. I call it endometriosis. You don't see yourself getting into depression, but because of the fact that it has robbed me of the quality of life that a woman at my age would be enjoying. And I'm not saying that I've missed out on things, but just as an individual person, just going through the perpetual pain, and it's tough. Like I won't lie, but it gives me so much life to talk about it, to be able to know, to advocate for the women who don't have voices, to speak up about it. Even just the fact that, for example, the Endometriosis Foundation has been added to the World Endometriosis Organizations, and I was also invited to sit on the committee. It's like, for me, I'm like, thank you, Jesus, at least, because today there are more people talking about endometriosis than there were even 5 years ago. So I keep looking at the progress that we have made as an organization, and I am proud of that. And for me, that gives me energy. But personally, individually, I usually reach out to my friends, and I have a very supportive family and a husband. And for me, I'm thankful for that, which is something that a lot of endometriosis warriors do not have. So when you're managing, I think one of the things that I would say to the girls out there is, one, we have a space. We've got a support group on Telegram. We've got Facebook. So if you follow us, we'll be able to add you. But just to help the women manage, we encourage people to talk. There's no shame in you going to see a counselor, by the way. Or, just anyone, talk about it, because it relieves that internal pressure that you're going through. And then you get to realize that you're not alone. And so, yeah.
Absolutely. We do have another phone call. Margaret, tuned in all the way in Eldoret. Good evening, Margaret.
Hello.
Hi, Margaret.
How are you? I'm fine.
Yes. Share with us your question.
I'd like to ask the doctor.
Yes.
About something that somebody has been sharing about stem cell therapy as part of management or treating endometriosis. Yeah.
Thank you, Margaret. Tuned in from Eldoret. We are going to respond to that right now. Thank you.
Okay.
Good.
Yeah, that's a very interesting question, and I think it's timely. There's been a lot of research going on around endometriosis, and as we know, it's a condition that was formally described in the 1920s. And we're still trying to understand what it is, and we haven't completely understood all its forms and shapes. And that just throws off balance the treatment options that are available. So for a long time, we've used hormone therapy to try and, modulate and regulate symptoms. And there is a quest for a cure. And I wouldn't say we've had, any breakthrough recently. There is experiments that are ongoing across the world, and some of these have been tested. To the best of my knowledge, I don't think we've got a stem cell therapy that one would claim to cure endometriosis.
Okay, Joyce from Ruiru also having a question. You can continue to comment on that. Joyce, good evening, and thank you for watching.
Yes, good evening.
Yes, go ahead with your question, Joyce.
Yeah, I happen to be a Edo warrior, and actually what Elsie is talking about, especially about the fatigue, and then sometimes people will not understand you.
Yeah.
Yeah, because they think it's like, you're exaggerating during the period, so it can be so draining. And I can concur with what she's saying.
Yeah.
About, at times you feel like you're depressed, you don't want to talk to people, because, there is that thing of, it's just a period, So most of those who are going through Edo, we are taken like you're exaggerating the pain, and at times it can be so bad. Then I'd also like to ask Dr. Muteshi.
Yes.
You have this variation. There's a month that you receive, the periods are not as heavy. There are times they will be so heavy. Is there anything maybe he can advise on? I know I have been in one of his forums at the Aga Khan, and I know I've also been connecting with Elsie, and I really appreciate what they are doing, because out there so many women are suffering. At times they think they are alone, but when they are such forums, at least you feel there are people who understand you.
Wow, Joyce, thank you so much for calling. Keep fighting. We are praying and
supporting
you.
And one last thing, maybe I'd also like to, there is one type of endometriosis, just maybe what I have gone through, the puro. At times you feel pain in the chest just before the period, and you may not connect it with period.
Yes.
So I think we really need to inform our ladies or young girls, because at times we miss out on the symptoms.
Thank you, Joyce.
Thank you for the good work. We really appreciate.
Thank you. Thank you.
Yeah, welcome.
That's an endo warrior. We should have like a, I don't know, something like when an endo warrior comes. Anyway, Dr.
Yes. Thanks, Joyce. Those are quite candid questions, and I think just to start with, you mentioned there's variation in period pain, and this may be down to various factors, and partly is because what causes pain in endometriosis is the inflammation around the breaking down of the cells that look similar to the womb lining, and obviously maybe the chemical amounts or the inflammation could vary with cycles, also depending on whether one is taking any form of medications or not. So certain drugs could dampen pain, and you may notice some could either lose effectiveness, or you may respond variously during various cycles. Now, it is also important to remember that whereas you may know you have endometriosis, it's good to be in touch with your doctor, and any new symptoms need to be looked at afresh, because not everything you will experience would be due to endometriosis. And it's true that you do get endometriosis in other places, and probably more commonly in the chest cavity. We call it thoracic endometriosis, so it's just outside the lungs. And this comes with cyclic pains or chest symptoms every time you have a period, and pain is common. So you may have to be clear or have a doctor who understands that there is a link between your period and something else. So you may want to keep a diary, especially if symptoms have been ongoing for a longer time. Keeping a diary is usually very helpful, because that can help us tie the loose ends.
Wow, I hear this often. Let's get checked. Let's keep in touch with our doctors. Different people have different symptoms of these various forms. Can I call them forms of endometriosis? I just really haven't had this conversation before. Forms? Endometriosis.
Yes.
Let's do that.
Yeah.
Wow. Even as we get to that, your pain has become your purpose, clearly,
Right.
literally. And have you, this question of it being curable, is it something you have thought about? Have you had this conversation before, and how did that look like?
I think when I first was diagnosed, and the doctor told me that this will never, there's no cure, there's no known cause, there's no known cure.
Yes.
I think that broke my heart. I think it broke my heart when I was going in also for the second surgery, because again, going in for surgery doesn't mean that you will, you will come out and you will never go through the pain again.
Yeah.
But it's because I was going through another type of surgery, which for us, I think the gold standard of the surgery and the management should be excision surgery, which I think, again, I keep pointing to him because he's the doctor.
Yes.
And he can tell us how, what excision, the difference between excision and the other normal things that we go through. So when discovering that there's no known cause, no known cure, I just thought to myself, there must be someone who is out there who needs a sense of hope, who needs to know that they're not alone. Because like me, I was struggling. I was out there and I was like, am I alone? Am I the only one? Because there's a stigma that comes up as a result of you being an endo warrior. Even right now, like people think, okay, like they assume that you're trying to get attention, unnecessary attention. And then you see, because we live in Africa and even around the world, just women, issues around women's reproductive health is not very well addressed. And for me, I think the one thing that has made me very passionate about this is because I have experienced the gender bias in healthcare.
Yes.
And I know that men will be given quicker response when they go into, for example, a health facility. And Charles, we're not being, we're not just saying this. There's research that has been done that men will get quicker attention and faster attention if they go into the ER compared to a woman.
Wow.
And it's actually fact, because I've gone into an ER and I'm, writhing in pain, and I've asked for help, and for 30 minutes I sat there and no one was helping me. So I had to walk out and go to another facility. But if a man comes in, for example, and I've become an advocate of it, even in the office,
Yes.
if I say I need the day off, they will still call me and say, hi, Elsie, do you have a minute? No, I don't. I'm unwell. But if a guy says he's unwell and he goes home because he's unwell,
It's a 911 emergency.
911, go home. They're never going to call you, never going to talk to you. The next time they see you is when you're in the office.
Oh my.
And even just the interventions for me, and that's what I fight for. I keep saying, guys, today we have a cure for, or rather, we have ways we can manage diabetes. There are ways we are managing cancer. And the people who are suffering, even just the total population of those people who are suffering, compared to the endometriosis warriors, the endometriosis warriors are more. We're enough to form the 8th largest country in the world today, if all the endo warriors were brought together. So why shouldn't we have that intervention? Why shouldn't we fight for insurance companies to provide that, to make that provision for chronic and recurring conditions like ours.
Yes.
We did not ask for this,
Wow.
And even like things like IVF, why are we paying, why is it expensive for me to go through an IVF cycle or treatment,
Wow. These are great conversations.
And that's what makes me passionate.
Yes, and you are creating those spaces.
Exactly.
But I want to applaud the gentleman here, because we don't want to give you too much grief. You're here also fighting this same battle. For you, 2 questions.
Yes, please.
One person asks, what age can one go in for checkup? And the second question is, this is from Dr. Jane in Limuru, saying, hi doctor, can endometriosis cause irregular periods? So we have those 2 questions.
Okay, I think I will possibly come to the question that Elsie addressed earlier, about excision surgery.
Sure.
But basically, the checkups that are designed across the lifespan vary depending on what we are looking for. So specifically for endometriosis, perhaps you may not have to worry if you have no symptoms, because pain is the predominant symptom.
Yes.
However, if you get your periods and you notice they are painful, then it's worth having a check with the doctor to find out what could be the reason. Now, not everybody will require laparoscopy. As I said earlier, maybe laparoscopy is the way to diagnose, but not everybody who comes through the door will end up in theater, and obviously that could mean that you are scared to come to see a doctor because they may send you to go and have an operation.
True.
The way periods flow is determined by a very intricate balance between mechanisms that will prevent excessive bleeding and at the same time not to be too robust to cause scarring of the womb lining. So sometimes this is dysregulated and you may find that one overrides the other. And especially where the mechanisms that prevent too much scarring outplay the other, then you may experience heavy bleeding. So, and that is not really endometriosis.
Okay. Okay. And have you answered the other one, which was what age?
Yeah, so the age would depend on what you have.
Are.
Yeah, exactly.
Okay.
Yeah.
Exactly. And so with the excision.
Yes. So I think the primary goal is to try and understand, especially where pain is a symptom, to define its character, because the character of the pain may tell you to an extent the cause of the pain. Yeah, so
for those who don't know, because I know, what is an excision?
So excision basically means taking away completely. So it's a form of operation where you have to, cut the tissue. Endometriosis is not normal, so it's grown in places that it shouldn't. So you have to remove it from areas that it's growing.
Let's talk about, the question was earlier on, since you've talked about other body parts, let's talk about the other body parts. What are some of the other body parts that are actually affected? Can you state specific ones, or it's different with?
We have described endometriosis in virtually every place in the body, but commonly the belly button or the navel would be a very common site to find endometriosis. So you may have swelling or bleeding from the from the navel. You may have the chest, as we said, is a very second commonest place you will find endometriosis, other than the pelvis. Now, within the pelvis, endometriosis could spread to organs around, which include the bowel or the bladder. So you could have, cyclic or bleeding every time you have a period coming from the back passage or through your water when you go to the toilet. So we may find endometriosis in these places as well.
This makes me very curious. Is this not generally hormonal? In terms of how do those cells go? Okay, It's fine. We'll have that one. As we... Elsie.
Yeah?
Your body. And you've agreed to share this with us. What have you experienced in terms of... You've already shared the emotional part, but physically, is there anywhere else you have felt the symptoms?
So for me, it was around my rectum.
Yeah.
And just the pelvic area, the general pelvic area. For me, I really thank God that it didn't go anywhere else.
Yeah.
So the second and the third surgery was really to give me relief. So they went in and cut the adhesions and, you know, the tissues that really just attach themselves to the organ. Because, like, and I don't know if I'm describing this properly, but, you know, like what endometriosis ends up happening is if you know, no one is going in to cut the tissue, is like the organs tend to attach themselves to each other. Yes. And that's what causes the discomfort. So I keep saying this, an easier way to describe like the pain that we go through with endometriosis is that cell is the only organ that was created to shed and bleed is the uterus.
Yes.
So if it is anywhere else, it's like drinking water and it going into your lungs.
Where it shouldn't be.
Where it shouldn't be. So that discomfort is what I generally go through. So in addition to the fatigue, just every month, pain, etc.
Wow, Daktari, the men who are watching and they're like, this is so awkward. How do I even, what can you tell them and how can they be supportive to those that are around them as you give us also your remarks?
So generally, we do know that girls would tend to go through the journey of endometriosis much easily if they have a supportive partner and or somebody who they can turn out to. And men need to be aware that the effects of endometriosis do not necessarily affect girls alone. And in a loving relationship, for instance, you may find that your partner is in pain, you can't do anything, and you may be expecting certain things and they're not forthcoming. You get frustrated. So, and as Elsie said, you visit your doctor and you're told, well, you know, you may not be able to have children easily. You require this form of treatment or the other. So it's understanding that full spectrum and knowing that you could urge your partner, you know, to see the doctor.
Yes.
Very, very sadly, I've seen girls who get a diagnosis of endometriosis and their men walk away, and it's mainly because of the misconception around what endometriosis is. You know, apart from the physical pain, what comes to mind immediately is, I read and Google that if you have endometriosis, you don't get children, and they walk away. So
I like that you've kept adding the word "don't get children easily," because that's not the end of the statement.
It isn't.
Absolutely.
Yes.
Absolutely.
Wow.
Yeah.
How can we get in touch and how can we get to know much more, because you're doing a lot about it? There's a word he used, support. Can I just ask, how does support look like to you?
I think for me is number one, empathy. So we don't want pity. There's a difference.
Yeah.
So we don't want pity, like, you know, oh my God, no. Stop. And then stop with the questions around when are you getting pregnant.
Stop.
And then we also get endobellies, and we get, you know, very bloated as a result. That's like one of the symptoms. That's how it manifests itself.
Someone once looked at me and said, congratulations!
Yes.
I'm like,
yeah, so unsolicited comments and, you know, even advice about how to manage pain. Stop. Like, we get it, but, you know, like now the way everyone now is a coronavirus expert, you're not an endometriosis expert. Like, just stop. Just be there for us.
Oh,
give us, validate our pain by just listening. We don't need you to come back with, you know, take soya or I'm not.
We don't want solutions.
No,
please.
we don't want solutions. Just listen to us.
Yeah.
Secondly, I think is support in the workplace. So, you know, provide a space not only for breastfeeding mothers, but also provide a space for women who are going through their menstrual cycle, because it's like it's a hormone fed thing, and it also impacts our emotions and everything, and just even our mental space and our head space, and even just physically you're tired when you're going through that pain. It's like you're revving a car, and so imagine when you're revving a car when you hear all that noise. So that's basically what we're going through. So provide a space for these women also in the workplace. I think for me it's to speak to insurance companies and say, guys, support us, because even the woman not many women can afford these laparoscopic procedures in very many health facilities. It's very expensive, and when the insurance companies hear that it's endometriosis, most of them usually are very the women are limited in terms of even the facilities they can visit and the doctors and etc. So just make it accessible. Let's make healthcare accessible and affordable for that woman, even in the mashinani areas. Like, think about that woman. I have privilege, but still, even my hormone therapy, I had to get Charles to write me like a 2-page document to explain to the insurance company
what is going on.
And this is not, don't confuse it for fertility treatment. It's just we're taking care of her bones and we're taking care of her heart. So, so for me, it's let the public also, for me, what support means, understand what endometriosis is, because the only way you will be able to give us support is if you understand it.
That's true.
And then finally is to family. I think for me, because that's the place where I hear from a lot of young girls that is where their pain was invalidated, and from a very young age, they were really demonized for. There was actually a parent who had me on radio one day, and she was just like, she apologized. She wanted to run to her niece to apologize to her for just being very tough with her. So at a family level, really support. Like, if you hear your daughter saying that I am going through this pain,
listen, be there for them.
Listen, address, take them to hospital.
Don't invalidate.
And as partners, let's love, and let's pray together. That's the
absolutely. We're about to wrap this up. We have about 30 seconds, but there's a question that quickly came in. Is there a special diet for people with endometriosis? I'm sorry, it's questions.
I think it depends on the symptoms. So, and you may notice certain foods could make your symptoms worse. So it's worth relooking at what you ate.
That's true. Thank you so much. Thank you so much, Dr. Charles Muteshi.
Yes.
Very nice to meet you.
Thank you.
And how are we following you? Let's interact with you quickly, just in 10 seconds. Facebook.
The Endometriosis Foundation of Kenya, and all the platforms, and my name also, Elsie Odhiambo, on all the platforms.
Thank you so much. Keep it right here on Health Check. It's on Hope TV. We ensure that you remember that health is indeed your greatest wealth. We believe in Jehovah Rapha. We believe that getting knowledge is just the way to not perish. Thank you so much. See you next week, same time, same place. Check out the reruns on YouTube, on Facebook, across our social media platforms, Hope TV Kenya. Until next week, see you. Bye. Thank you, guys.
Thank you. Thanks for having us.